great lecture yesterday. Quick introduction on Domenico. He's a third-generation professional farrier who graduated in 1999 from the military farrier and veterinary school in Grosseto in Italy. He has a keen interest in equine podiatry and locomotion, and this interest has prompted him to design a special device that reproduces the equine fall-in with its functional position, body weight during different stances and phases of gait, which we saw yesterday. Domenico is an international speaker, educating farriers and vets. Thank you, Domenico.
Thank you for this wonderful introduction, and thank you for the invitation for this amazing event. The topic that I want to talk today is about low heel on platform and the influence that this conformation has on the whole limb. This study that I made it with the partnership with Michael Savoldi, because Michael spent whole life to study this kind of conformation. So, what I'm talking today is about the science, because we need to make some study to understand what's happened in locomotion. The question is why science is so important. To have a better explanation, it comes always from the history. This is a story, it's very famous in UK. It talks about Eclipse. Eclipse is the best racing horse that you had in UK. In 1769 and 1760, the Eclipse dominated the English horse racing. It was unbeaten, and it was retired in 1770 and stood at the start until he died in 1789 at the age of 25. And the Eclipse owner wanted to understand the secret of Eclipse success. And for this, the veterinary expertise was needed to understand this kind of secrets. And thank you, Eclipse, the Royal Veterinary College was built to study the secrets of Eclipse. And thank you, Renata Weller. I had some meetings at Royal Veterinary College, so I had a little talk with Eclipse. And also at Royal Veterinary College of London is preserved the books that collects all the data information that they made on Eclipse. What they did at that time, it was just study the anatomical aspects of Eclipse using geometric measurements to establish ideal proportions. I think that it has been the first attempt to study the horse to understand the athletic abilities. 100 years later, United States of America, in 1872, the governor of California, Stanford, a racehorse owner, hired Muybridge for some photography studies, because in the club they had a debated question whether the whole horse feet of the horse were off the ground at the same time while trotting, because on that time it was common to see this painting on the wall. So Muybridge in 1872 began experiments with 12 cameras, photographing horses galloping in a sequence of shots. And Muybridge improved his study, creating and developed Duprescope. It's a machine that is possible to see what the slow motion of the horses. You glue the shots on the disc, and with this machine, Duprescope, is what we can see now on YouTube. Muybridge has been the pioneer of modern slow motion video. So the question was, why science is so important? It's important because with the intellectual and practical activity associated with the systematic study, it is possible to develop theories to describe the natural world. In few words, with science, it's possible to find explanations. Now we go in our topic. We start with the low heel. Low heel is just a definition to identify a particular hoof conformation. And what I'll show you today is how we can recognize a low heel without X-ray pictures, because it's easier with X-ray pictures. We have this foot. Normally, the low heel is has a particular conformation because it has a big flare on the toe, but with this foot we haven't this flare. So you see the tips that can help us to understand if we are working with a low heel is just to compare the angle of the heels with dorsal wall. The dorsal wall has a higher and steeper angle than the heel, and also the corner band has a negative angle. If you see the low heel in front, if you have the dorsal lateral wall, the lateral wall and medial wall has an oblique angle. If you compare the width of the corner band distal border is wider than the corner band. For fire, low heel is also identified as a wide foot. When we pick up the foot between our hands, we can see this. And the low heel has the bars are on oblique angle, more open. And we have also low commissure vertical depth. And we have the migration of the heels to here. We have long and oblique heels, underrun heels. On this view, it's easier to understand that the frog is above the sole, is always above the sole. In other foot, you have to carving the sole to find the apex of the sole. What is typical in low heel is the concavity of the sole in the toe area. And it's common to see white line disease or stress around the toe. Low heel has a different name. It's also identified as underrun heels and like a syndrome. Syndrome is a complexity of factors that are involved to affect the hoof capsule and structures within the hoof. So the new terms of identify low heel is low heel or underrun heels syndrome. What I showed you before is just recognize, you see, the low heel with the external aspect. Now we give a look inside the low heel. What we can see with X-ray picture is, it's common to see horizontal or negative palmar angle, the sole cavity in the toe area, and the apex of the frog above the sole. And of course, low commissure vertical depth. This is all the information that you can identify on X-ray to identify low heel without making measurements. Just give a look, you can understand we are working on with low heel. And we are seeing how we can recognize low heel without X-ray. So I'll show you this look inside, and all this information that we have to recognize the low heel has an effect, because my question is how this factor can affect the structure within the foot. We know that during stance phase of gait, the palmar angle rotates around its joint, changing its position inside of capsule. The coffee joint is the first center of rotation. It's the joint where the palmar angle can make its motion. How you can see, during the stance phase, the palmar angle change. It's not the same what is showed on X-ray, because X-ray on the vet exam is a static picture, but it doesn't mean that this palmar angle is the same during the stance phase. It changes every time. Important to know, the suspensory apparatus, like superficial digital flexor tendon, undergoes extreme tension during the braking phase. And the braking phase represents the first stage of the collision of the mass of the horse with the leg on the track. Just to summarize what I said yesterday. So you can see now just the braking phase. Without the distal limb deformation at the impact, the forelimb would be broken. The primary function of the foot is to dissipate the shock of the impact, responding in hoof internal structures deformation. Now you can see how the horse foot, mainly the low heel, has a deformation when impact the ground during stance phase. What you can see here in this picture, you can see very well the Parma angle is 1 degree, and the distances between the proximal and distal lamina. What we can see during the stance phase, during the breaking phase, when the limb is loading, the Parma angle decreases. And what you can see very well, that only the proximal distance of lamina increase, because the wings of P3 is pushing against the heels, and for this, the extensor of P3 is stretched. So during the breaking phase, the Parma angle decrease, the proximal lamina distance increase, and this distal lamina distance is constant, it don't change too much. To break here the motion of P3 inside of capsule, with this video you cannot see the Parma angle. You can see just distances between the wings of P3 and the distance with the ground. And what you can see of the breaking phase, the P3, the wings of P3 is compressing the digital cushion, because you can see the distances between the wings of P3 and the ground decrease. So the Parma process increases the pressure in the digital cushion, lowering the commissures, and the frog prevents the Parma process from collapsing, but at the same time it develops compression to the digital cushion. And if you give a look, the sole on the toe here, when it's lost, it is stretched, it becomes thin and flat. It's amazing because what I have found in my study is what Michael Savoldi tried to explain for 50 years. Michael Savoldi is doing an amazing job. He said that his shape and position of P3 develops particular cell body conformation, and these are strictly correlated. This is a healthy sole, and we have a sole where the sole of low heel. You can see this big changing, because on low heel you can see also the body of the sole in the healthy foot is completely disappeared. The only thing that we have to be clear when we treat horses, that the damage that are developed inside of capsule is done. We destroy the structures, and the structures have the power to replace what is broken. So could be worse. And what is happened with the low heel, it is just this. There has been a huge compression on the sole body. You can see a flat sole. So what do you have? We have the collapse to the toe arch, and the collapse the Parma process of the Parma process arch. And just to put the P3 bones above the sole, you can see very well that the P3 bone and its position develops pathologies to the sole body. Pathologies means pain, because we are destroying the anatomical parts. In summary, horizontal negative Parma angle develop the shape of sole body, collapse sole body, and the same when the sole body is collapsing, develop bone shape, develop pathologies to P3. It's like a chain. The position of P3 develops pathology on the sole body. The sole body itself develops pathology to the bone. In this view, it's very clear what's happened on a low feet. You can see very well, mainly on your right picture, is how the position of P3 has completely destroyed the arc of the sole. Misconception. Our traditional faria and vet education says the palmar angle influences the deep surface tendon and also the superficial. What we've seen yesterday is not true, because the palmar angle doesn't change too much, but the load on the tendons is very high, because the palmar angle is not the key factor on stresses of the superficial FX tendon. Palmar angle is the key factor that develops pathologies on the, inside of capsule, mainly on the sole body. And we know very well that the fetrock joint is the key factor that develops pathology of suspensory apparatus. So it's very important to understand these two different key factors. P3, the position of P3 develops pathology inside of capsule. Depends on the conformation, the palmar angle, and many other factors. The fetrock joint angle, a fetrock joint, is the key factor that influences stresses of the flexor apparatus. You can see very well, just a fast review about yesterday, you can see very well that when increase the loading of the fetlock, increase the angle of fetlock. Increasing the angle of fetlock, increase also the tension of these flexor statues, that they tried to avoid the collapsing of the fetlock itself. So normally our whole standard education taught us that the wedge pad can help, you see, the low heel syndrome. What I did, I have the same limb, the same protocol, in the same position. What is changed? That I've had a wedge pad. This kind of wedge pad, when they bought it, it is written that increase the 3 degrees. But I have an angulometer at home, and making the measurements, it did not increase the angle of 3 degrees, but increased the 5 degrees. So what is changed? Comparing with the foot without the wedge, you can see very well that the dorsal wall in the foot with the wedge are more parallel to the heel. With something is changed with this mechanical support to the heel. And to have the parallel dorsal wall and the heel, the parallel is, I would say, the goal when you try to shoeing horses. And what you can see also, we have a little improvement about the coronary band. If you compare the wedged pad with the foot without the wedge, you can see that the coronary band is more horizontal. This is what we can see externally. Now we give a look inside with X-ray pictures. What we can see, the palmar angle here on the left is 0 degrees. If you see what is happening with the wedge pad, we increase the palmar angle. Now we are plus 2 degrees. And if we draw the line across the axis, because I said you yesterday, our goal is to have a good axis alignment, because this for us means that we have did a good trimming and shoeing. So on the foot without the wedge, we have a broken axis, but But if you compare the wedge pad with other one, we have a better digit, axis. It's closer to the ideal. So what we can say at the first look, potentially wedge pad establish a normal foot distal limb angles as described in the book. My question is it right? So now we go a little bit deep in my studies. So you can see always the same protocol standardized. On the left, you can see the foot without the wedge, and on the right, you can see the foot with the wedge. You can see very clear that with the wedge we increase the angle of P3 about 2 degrees. You can see also if you compare the distal lamina of the proximal on the wedge is increased. but it doesn't change too much on the distal. And we,
Is this under load? Is it under load?
yes, because now it's under load.
Your press, yeah?
Yes, it's my press. But this is the load is not higher because now step by step I show you how. And okay, another thing is you look at the distal interphalangeal joint is higher than the foot without the wedge, because when we had the wedge pad, we mechanically make a big changing on the hoof. And what is changed also the position is the distal interphalangeal joint or the coffin joint, because this joint, if you compare the foot without the wedge, is higher. So now we can see when we are loading the limb, what's happened. What's happened can then the parma angle on the wedge foot is always higher than foot without wedge. But what you can see, the stress on the proximal lamina is higher because the wings of P3 is pushing against the ground. And for this, the extensor process comes far from the wall. What we can see also, if you compare the coronary band, and on the right, there is the P2 displacement, because this P2 displacement increases the stress to the extensor tendon and increase the friction between P2, the extensor tendon, and the coronary band. And this combination could develop ring bones. So this is what we've seen before, step by step in motion. You can see how fast, this is slow motion, but you can see how fast the angle change, how fast it changed the distance of proximal lamina, and how fast it changed also the displacement of P2 in a wedge pad. Just to emphasize the motion of P3 inside of capsule, I simplify everything without the parma angle. What I simplify that what we've seen that the apex of P3 it is just a fulcrum. It looks that doesn't move. The only motion that we have is also the back part of P3, and the back part of P3, if you compare and make the measurements of the distances, the foot without say wedge, the distance is almost 2 centimeters. But when I have had the wedge pad, the distances for gram is not the distance for gram, but the distances between the wings of P3 with the proximal border of the wedge is lower. When it's low, it means there is more compression to digital cushion because the wings is working against the digital cushion. Or you can see in this video. So during the breaking phase, when the loading is acting heavily, what's happened with the wedge? The wedge pad, it's happened that the wings, the distance between the wings and the ground is shorter. If it's shorter, this means it gives more compression. And what's happened if compare this area with this one? You can see there's like a bump because there is a digital cushion. When you compress from the back, you have to move to the top. And also the compression to the digital cushion is not developed only from the wings. You remember the low heel has a big frog. The frog's job is to contract the motion of wings of P3. So the digital cushion inside of capsule has two pressure, one from the wings, the other from the frog. So in the wedge foot, the digital cushion is more compressed. And the P3 also the sole concavity into area are stretched, becomes flatter, thin. Now this is very important because we have seen what's happened inside of capsule and what the pathologies that develops you see, the motion of P3 inside of capsule in low heel. But see, it's not enough, because we know very well that the fat lock is the key factor about the injuries of the flexor structures. And now we can understand if we can have some benefits for the wedge. Because normally we add wedge pad to relieve the pain to the flexor structures. What we can see in this video is very clear that on the wedge pad, the fat lock joint angle is more open. And you know, when it's more open, this means that develops more, tension to the superficial iliac flexor tendon. In the wedge pad, the fat lock joint angle is more open, increasing deep iliac flexor tendon and superficial iliac flexor tendon. Conclusion. Low heel conformation is associated with specific foot pain, localized in a specific area of the foot. From the quarters to the heel, negative palmar angle causes mechanical overload of digital cushion, resulting in atrophy and prolapse, weakening the heel. In the toe area, the sole lacks normal concavity, becoming thin and bruised. Using wedge pad as orthotic device to achieve heel height and a better pass angle can have negative consequences. This means, what I'm saying is, this doesn't mean this is wrong. Maybe it could be useful to treat pain or some pathology for the horses, but maybe it could be useful, like I explained yesterday, Paul, like extreme pain or pathologies that you have had wedge pad. But you can use wedge pad to rehab horses. This means it's not wrong, it could help, but normally the wedge pad has not, you say, good, can give the horse a good help to improve maybe the flexor problems. Now we are talking about the low heel. Now we talk about high heel. High heel is completely the opposite of low heel. So what we can say now, just did before with the low heel, we just recognize upright foot without X-rays. We have the upright foot. What we can see, we have a dorsal wall. It's normal. You have a concavity on the dorsal wall. It's typical about upright foot. And what we have the heel, and we have the steeper heel angle than dorsal wall. If you see the coronary band is more or less horizontal. If you will see the horse foot in front, we can see the medial lateral wall, and we have a straight medial lateral wall. If you compare the distance between coronary band and distal border width is almost equal to the coronary band. Sometimes it's narrow. Now we can see the foot from the bottom. We have the upright foot. We know very well we have the bars. The bars are vertical. And it's very common to have a white line stress in toe area. And we have a narrow foot. This is typical in a high heel. And we give a better look. We have other information to identify the high heel. What is characterized to the high heel is the high commissure vertical depth, narrow frog, and the other thing is in the toe area we have flat sole. Now we give a look inside this high heel on X-rays. On X-ray we can see this one. We have a positive palmar angle. Distal lamina is very stretched. Just with your eyes, you can see very well that the distal lamina, this one, is wider than proximal without making measurements. You just look this X-ray, it's very clear. We have a flat sole in toe area. White line stress, it is very clear on X-rays. And I can measure vertical depth. Of course, narrow frog. You can see very well that the frog is not touching the ground because it's very narrow. Now, we can see now how P3 interacts in a capsule. What you can see now, we have a Parma angle is very high, it's 6 degrees. And if you see the proximal distance of the lamina with the distal, you can see very well that here it's a big difference. Proximal is 1.7 centimeter, and the distal is 2.2. And looking at the video, you can see that Parma angle is exactly the opposite of the low heel. When the limb is loading, Parma angle increase its angle. Increasing its angle, this means this rotation of P3 against the ground. And when there is this kind of rotation, we increase the distal distance between distal lamina. So, during locomotion, at the braking phase, Parma angle increase. The proximal laminar distance increase because P3 moves in this way. So, the distal increase is width, but the extensor process move against the wall. So, the proximal distances of the lamina decrease. I explained you before, distal lamina increase. So this is another way to explain better the motion of P3. The motion of P3 in this way, I show you how it changes the distance.
Fireboat run from in this area will now be at sea the best standboard. Thank you.
But I want to show you the distance between the apex of P3 with the toe, a distance between the apex of P3 with the ground. What you can see, the distance between the apex of P3 to the ground decrease. This means that that the P3 has a penetration of the sole. What this means? It's like the P3 want to touch the ground. Also, the distance between the apex and the dorsal wall increase because this rotation increases the distances. And this is why we have white line disease on the upright foot, because there are many mechanical motion inside of capsule. And you see, the wall is not very elastic structure, but the sole is a very elastic structure. So the motion of P3 is pushing against the ground, give a higher stress, higher load, higher pain to the sole. The sole is very elastic, and what will happen is we lose the attachment between the sole with the wall. So, as I said before, we have penetration of P3 in sole body. The sole is stretched and becomes flatter, and the sole detached from the wall. In summary, P3 apex develops pressure in the sole body in the toe area, lowering the distances between P3 apex and the ground. The distal sensitive lamina are very stretched. The sole lax concavity become flat and thin. Now we can see how Michael explained, because he's a master on this. We have the head sole body, and we have on the right the sole body with the P3 bones. This P3 bone is a high heel. Is the foot that comes from high heel. What you can see here, you can see very well, this penetration of P3 in the body of the sole. And what we can see here, when P3 is pushing against the sole itself bend. And when the sole is bending, it's working against the P3 bones, and it develops also the pathology of P3. You can see many times, not in young horses, like the X-ray that I'm showing you, because the limb that I've used for this study is also very young. But when you have a old horse, you can see how the management of the distal border of P3. So what's happened? P3 bones develops pathology to the sole body, and the sole body itself develops pathology to the P3. The question is it better to manage or make correction to upright foot? What I did what normally I do in my daily life as a farrier. We have a upright foot and trim on the left and trim on the right. To identify how much heel I can remove, I identify the front wall junction is when the angle of the heel match the angle of the frog. We are packed. We are in wrong room. This is identified as heel length. What I did when I trimmed, I just trimmed half length of the heel. And I trimmed from the apex of the frog to the heel. That's it. When you trim just from the apex of the frog to the heel, there is a little bit gap on the toe. With your ass, I just make a good flat plane to work on my machine. And of course, I just cleaned a little bit the sole. You can see here the sole is very shiny. You can see the age of P3. This means we have a good foot with a lot of sole, but it doesn't mean that a lot of sole that you will see is enough to protect P3, because just to clean a little bit, you can see the age of P3. The other question is, when we see X-ray pictures, the position of P3, many times the distance between the apex of P3 with the ground is to identify the thickness of the sole. But I think that in this case, you are not talking about the thickness of the sole. We are talking about the penetration of P3 in the sole, because the bones you can see very clear in the X-ray, but the sole you cannot see very well. So when we make this kind of measurements, I think we have to change the meaning. We are measuring how the P3 bones is penetrated in the sole. Okay, in this view, you can see here in untrimmed, we have high commissure vertical depth, trimmed heel. Of course, we have a low commissure vertical depth. Of course, you can see a little bit less white line stress, because when leveled you see the foot, I just clean a little bit the distal border, and so the white line stress, it seems less than untrimmed. Comparing the foot with comparing the trimmed foot with trimmed foot, you can see very well immediately that when trimmed heel, the foot is a little bit longer. What is changed immediately? We have the steeper dorsal wall and the heel angle. The recovery band is horizontal on untrimmed. With the trim, you can see we have a oblique and heel angle angulation. So on untrimmed, we have steeper angle between the hole and heel, but lowering the heel is changed. And we have a horizontal corner band. Now we give a look inside what is changed. What is changed immediately that the palmar angle is 79, because the palmar angle is 79 is different because it's not loaded, the limb. Just put in the press like the horse is standing square when you make a vet analysis. So comparing in mid-stance phase, the palmar angle is almost 80 degrees, lowering the heel, we have a 3.5 degrees. Of course, if you trim the heel, the vertical depth of the commissure is less. So now we can see what is changed trimming the heel. Just restart the video so you can give a look. What you can see in this video, you can see very well the Parma angle is more horizontal than untrimmed. And what is changed? On trimmed foot, this distance is decreased. This means there is less stress on the distal lamina. And if there is a less stress, you say, distal lamina, this means that P3 bones is less, there's less rotation P3 bones against the sole. And when we talk, say, about stress about lamina, we talk about inflammation. And when some anatomical parts are inflamed, develops pain. I thought that a very inflamed inside doesn't grow. You have a problem. You can give all the biotin you want, but it doesn't work. So our job as a daily is to the first thing to give comfort to the horse. If we can understand we have pain, we have to find a solution that we have relieve the pain of the horse. This way we can just give immediately a benefit, and you can see in 4 weeks or 6 weeks the growth of the doof capsule is amazing. So we have a less, the average of Parma angle is 4 degrees less, and less distal sensitivity laminar stress. So what's happened, the distances between the apex P3 with the ground, what is changed? Of course, the distances with the trim is less than, I say, the untrim. And in this video, you can see very well, changing the trimming heel, we change the Parma angle. Changing the angle, Parma angle, it change the position inside P3. Because we have not forget, because the digital horses has the joints that are called center of rotation. We have 3 center rotation. So what we did with the trimming, when we add wedge pad to the horses, the joint of the distal forelimb has a power to adapt their orientation. What's happened here in upright foot, lowering the heel, immediately we change the Parma angle. Change the position of Parma angle, you change also the motion inside of capsule. And when you change the motion of capsule, we can, produce less pain to the sole. So Parma angle is more horizontal, there's less pitch apex penetration in the body. So now I've seen the benefit that we have lowering the heel on upright foot, what's about what happened inside the capsule, about the distal lamina and the sole. Now we can see changing the Parma angle, I said before, we're changing the orientation of the center rotation, and we can see very well and very clear that we have a big changing immediately about the fetlock joint angle, because in untrimmed, the fetlock joint angle is 15 degrees, but with the foot that we have trimmed the heel, the Parma angle is less, it's 12 degrees. So lowering the heel in upper foot, we have 2 benefits. We can relieve a little bit the pain on the sole, and we reduce the pathology. We relieve the pain to the sole, reduce also the stress on the white line, and at the same time we have the benefit for the flexor structures. You can see this motion that the fetlock joint angle is less. In this way, we can help to have a less stress to the flexor structures. Okay. So conclusion. Upright foot conformation is associated with specific foot pain, localized in specific area in the foot. From the beginning of quarters, positive arm angle causes mechanical pressure to the whole body, resulting in collapsing. In the toe area, the sole lax, the concavity becomes flat and thinned. And there is a remodeling of the pitchy bones is a consequence. Trimming carefully the heels, palmar angle is lower and decrease negative effects on the soft surface around pitchy, and we relieve the pain of the flexor structures. But lowering too much the heels immediately, the horse may not able to place correctly the foot on the ground, and responds in activating the pain receptor of the whole limb. This is what happens when you immediately want to change the palmar angle, lowering the heel. Because I think this is another misconception. The people say, okay, the low heel is a flexor problem. Yes, it is a flexor problem. But when you lower the heel, the deep flexor tendon is not painful because it is very strong and very elastic. We do a big change on the collateral ligaments. The ligaments are very rigid and the collateral ligaments are very short. So when you change too much the palmar angle, trimming too much the heels, the horses they cannot place the foot correctly. They try to stay on the toe because for me, the collateral ligament had no time to adapt for the new conformation. And the horse is very painful. So when you're showing the horse the next time, you can see you have more heel length than before. So when you trim the heel, you have to be very careful. What I'm doing normally, I trim the heel a little bit, I place the foot down. The heel is touching, okay, I can trim again, I put down. I stop when I can see just the heel is not touching the ground, but just a little bit. What you can do, maybe you can do the upright foot, the first foot when you're shoeing. You try to trim and prepare the other 3 feet. After that, you can see, okay, the horses have had time to adapt to conformation. The heels is touching the ground. Okay, I try to do another trim to the heels. This is my approach about upright foot. So, low heel or upright heel syndrome. It's normal, it's common to see low heel, upright foot in the same horse. These are Spanish horses. You can see in the left foot is high heel. Okay, we are talking just till now, we are talking about the foot. But the low heel or upright foot is not a foot problem. There is also a body problem. To understand this, it's very important to compare always human anatomy with horse anatomy. We have the 2 skeleton. On the left, of course, is the skeleton of human. On the right, a horse. And humans has the scapula. And the scapula is connected with the body, with the clavicula and the muscles. But horses, the scapula is connected with the body, with muscles. We have not the clavicula. The clavicula is important because with the clavicula, we know that scapula is still there. It could be more open, more closed, depends on how strong the muscle hair they are. But with the horse, the scapula is completely free to move. So when there is some changing above on the foot, always there is a changing in the body of the horse. We have the same horse with a mismatched feet. You can see on the left low heel, and we draw the line across the scapula. We have an oblique angle of scapula. And upright foot, the scapula is more vertical. And what I understand, the upright foot is always a little bit backward than low heel. This is what you see when you see the horses on lateral view. If you see the horses in front of you, this is the shoulder joint. On the hay, we can see just with the eyes, because you can see very well this different shoulder joint about the height. And the limb of the low heel is called functioning shorter limb, not because the horse has a shorter limb. it is a joint angles combination that change the functional length, because we have a different angle of the shoulder, it change also the point of the shoulder, and also the position of the limb, it change. And you can see very common when you have a mismatched feet, you see in the front, you can see the lower heel, the point of the shoulder is it is always lower. Of course, we have different muscles because Jenny was explained very well. There is always an asymmetry. And mainly, we have a bigger asymmetry when we have asymmetry in the feet. So, the flexor shoulder and the muscle of the upright foot are more contracted than low heel limb. This leads to inappropriate limb loading. Indeed, the upright foot has a shorter stride than low heel. We have the same horses. You can see this is left hand, which is upright foot. What you can see, the limb motion asymmetrical with the right foot. But if you want to move the horse on the, on the right end, the left is always the upright foot. But you can see the stride of the upright foot is shorter than low heel. Normally it would be longer because limb inside has more weight. It would be a little bit short because it supports more load, and the outside limb it would be free from the load. It would be more pendulum effects. What's happened if you want? So left limb does extended lip throat limitation. What happens if you want to ask more extended throat to the horses? The horse is moving in his hand, right hand, because. But we want to ask more. Is try to ask more trotting. What's happened? The horse prefers to gallop because it's comfortable. The horse is prefer to gallop in left hand. By the left hand, you have seen before, with a moderate throat, the limbs were more or less symmetrical, but there are problems with the muscles because are more contracted. So it's typical with mismatched feet, the horse does like to trot with a standing throat because he has body limitation, and for this he will prefer to gallop. Conclusion. Low heel and upright foot syndrome is not only a symmetrical heel aids. We must manage two different foot conformations associated with pathologies that are exactly the opposite to each other. Asymmetric feet develops asymmetry in the limbs, it's not all the foot, and it's correlated with both body postural compensation. The locomotion lose symmetry, affecting the horse performance, becoming a potential source of lameness. With this overview about low heel and upright foot, we have a better knowledge about their pathologies. Pathologies means pain. For horses with mismatched feet, it's essential the partnership with the vet to rehab the muscles, reducing the body postural compensation for a horse with a better symmetrical motion. What I try to explain, what I'm doing with my study is full funded by myself. And to do this study I was in trouble because the time was unlucky because I have broken many parts of the machine, and I have a problem to have an X-ray machine at home. And I'm very lucky because I have very good friends. And just talking with John and Monique, I explained them, oh, I have this problem, I cannot go on with my study because I broke my machine, I can have a vet at home, you see, for X-ray pictures because I have not panel. And these people are very, very kind. They helped me, giving me the tools, the technical assistance. I had the technician for 2 days with a remote control with my laptop to introduce a new software to help me to make collaboration on X-rays. They make a huge job without give them back something. They are very kind with me. This is the first time that some people help me. Thank you.
you, Domenico. Another great lecture. Have we got a question?
Yeah, it's interesting with your raised heel pads.
You're talking about wedge pad.
Your wedge pad, yeah, sorry. Have you done any experiments with the 3D frog pads?
No, not yet, not yet. This is the first attempt that I did about low heel operative foot. I did the basic because when I try to make a study, I start from the basic. Now the study, I can do everything. Maybe add the wedge pad, rocking the toe in the low heel. Maybe we can have a benefit. This is a starting point for me. Indeed, I'm using the barefoot foot just because I don't want influences by humans, just understand the principle of this structure is move normal. After that, I can add everything you want. Shoes or other kind of, you see, wedge pad with frog support or other things, yes. Not yet.
All right, we'll give Domenico a round of applause. Thank you.
Oh, thank you very much.